Hi, and welcome back to In the Gray Area with Revv Health. I'm Britni.
I'm Travin.
And today we're doing something a little bit different. We're diving into your YouTube comments. We have been blown away by all of the growth with this channel lately. So many new subscribers, incredible engagement on recent episodes, and honestly, some of the best questions that we've seen yet. And big news, we just hit our first milestone with the YouTube Partner Program. That's a huge moment for our team, and it wouldn't have been possible without you. Thank you for watching, commenting, sharing, and being a part of this community with us. Truly, we appreciate you more than you know. So today, we're going to take the time to respond directly to your questions and comments, clear up some of the misconceptions, and keep this conversation going around hormone health, longevity, and feeling your absolute best. Let's get started.
Today, we have our good friend and producer, Kolton, back with us. He's going to be asking some of these questions that you guys have been dropping on our YouTube channel. So we'll get into it.
What's up, guys?
What's up, man?
Hi there.
How you doing over there?
Good. Good to be back here behind the soundboard. All right, question one that came in. Somebody wants to know if you can stack GLPs.
Yeah, I mean, you can. I don't know that it's really necessary in most cases. I know that I do see some people talk about like stacking like tirzepatide and retatrutide, like low dose together, just because of, we talk about like the appetite suppressant impact is much better with tirzepatide than reta. But I mean, I personally wouldn't do it. I don't see any need that.
I agree. I don't think there's a need to. You're going to get enough from one. You don't need both.
Yeah.
It's either one or the other, and just figuring out which one's better for you.
Yeah, for sure.
Okay, I'm seeing a vast majority of the questions that have come in are all pertaining to GLPs, the risks attached to them, or opposed to the benefits. Obviously, too many questions for you guys to answer them all here. What would you guys say, just summarizing somebody who's just curious if it's worth it?
I think we talk about it a lot. Like, there's so many benefits from the GLPs, but more than anything, it's really important that you're working with a provider that knows how to work with them with dosing and titrating up and down, and encouraging you to make better lifestyle changes with like diet and exercise and stuff. So I would encourage you to just reach out to a provider or reach out to us and ask us personally.
Somebody commented on the longevity aging episode, and they said they love KPV. Added it into my BPC TB-500 GHK-CU. It's a very nice anti-inflammatory blend. It's kind to the body. It's not a question.
Sounds like an amazing stack.
Well, yeah, that's that new one that it's like,
I want to try it.
It's
still
not the glow. People call it like the Clo, like kale, like because it's basically the glow stack with
plus
the KPV added to it.
Yeah.
And so
I love
I know
the glow.
Yeah, the glow's good. We've never done that KPV.
No, I keep talking about it, and I haven't.
I know it's like a really good like anti-inflammatory one, but yeah, like I mean, I've you know me, like I've traditionally in the past like been kind of against like the blends. Like the ones where everything's blended, like in one vial, like
it's just hard to find adequate amounts of dosing.
It's hard, yeah, because it's like you can't customize the dosing, but then it's like, who wants to sit there and like inject 4 different in 5? So it's like, I mean, I understand like it's total convenience thing for sure, but it's
but that sounds like a great stack.
It does, yeah. I know I've seen it pop up a lot lately. It's a good one for sure.
Okay,
yeah.
On your hormone therapy red flags episode, a gal said, I'm a female, age 54, getting HRT in form of femostin, and I am in perimenopause, but I started taking 12.5 milligrams of DHEA because I'm hoping my body will change it into testosterone because tests shown it was low before. I guess I need to test to see what it is doing. Should I rather get testosterone or Anavar for the benefits instead of DHEA?
Okay, well, that's a
lady
lot.
Asked that?
That's a lot. Well, you need testosterone, most definitely, and DHEA is going to help with joint pain and stuff like that. So you're not going to get the same benefits from just taking 12 milligrams of DHEA that you're looking for.
No, like that's, I really like cringe when people try to do this with, like, oh, I'm going to raise my testosterone through DHEA. And it's like, it's going to be so little. Like, yeah, you might get a tiny, tiny bit of testosterone conversion through the DHEA as a woman, but
there's a lot of factors that go into play.
Yeah, but it just goes back to, it's like, look, like if you want to raise testosterone, like, why don't you just raise testosterone? Like, why are you trying to raise it through DHEA in hopes that it's going to raise
Well,
it.
what I would tell her is, especially like at 54, by like using a testosterone cream vaginally is going to help with so many other issues too, with vaginal dryness and atrophy and stuff like that. That's totally going to be your best bet.
Yeah. It's funny. I don't know why she added the part about Anavar in there. But
Well, I'm thinking
you know,
maybe it has something to do with joint pain and stuff like that. So
Yeah.
she could just take, I'm sure she
there's
should
no-
just talk to her provider about testosterone and DHEA.
yeah.
This viewer asked, what is the best blood work to get to make sure everything is functioning correctly? What do I need to specifically ask for?
That's very vague because we have a very, very comprehensive blood work panel that we have developed for our patients. So, I mean, you're going to look at metabolic, lipids, all hormones. Like we personally look at 55 different health markers as well. So it's kind of hard. I mean, we can't really tell you what specifically.
I mean, yeah. I mean, you can, if you're just looking for something that's kind of like general, like overall health, I mean, it's like, that's kind of what ours is. I mean, you can really, we talk about it a lot, get carried away with lab work. But it just depends on what you're specifically like trying to address. I mean, if there is something specific or, if it's just general, I mean, there's definitely panels for
Was
just
this
kind
a
of like
man or a
general
woman?
Not sure.
Not
Yeah,
sure.
hard to
Okay.
tell, yeah.
I was going to say, because a lot of times I know as women, if we go in and we ask for a hormone, like have our hormones tested, half the time we're not even looking at what we really need to be looking at anyways. So that's hard.
The hormone therapy red flags. This viewer commented and said, you can actually start estradiol and progesterone in perimenopause. The bloating happens whenever you start hormone therapy.
No.
It evens out after a month or two.
That's not correct. It's actually very dangerous if you're not clearly in menopause, which there's different factors that you have to look at. But if somebody is not in menopause and has had a cycle within the last 12 months, they should never be taking estradiol. It doesn't matter if they're taking progesterone with it.
Yeah, you're just asking for trouble. You're asking to like exacerbate, symptoms and side effects. And you're like, look, yeah, you can do whatever you want to, but it doesn't mean that you should. I mean, and so I know it's popular, especially in this whole like functional medicine world. Like it's very popular to give women in perimenopause estrogen, and a lot of them are on it, but that doesn't mean that you should be doing it.
Is this like a patch or a cream too?
Probably. That's usually what it is. It's usually a patch or a cream. A lot of times it's a patch that when you're in that whole functional space. But just because you're doing it, and just because there's providers that do it doesn't mean that it's the right way to do it. Yeah.
So also in the hormone therapy red flags episode, were you saying that you want men's estradiol numbers to be the same range as women? Or is there a specific test estimate ratio you want to maintain for men? What drugs do you use to treat thyroid? Do you deal with people who don't convert T4 to T3 well? Great episode.
Okay.
That's a lot in one.
Yeah. I mean, yes, we deal with people that don't convert T4 to T3 well, because that is actually most people have that issue. And that's why most people don't benefit from T4 only therapy. So yes, all day long, we work with that population of people. Question about estradiol. Look, like we don't routinely check estradiol levels in men because, we don't need to. We know it's going to, just like testosterone, like it's going to rise. It can cause a lot of confusion with those numbers. But to answer the question, yes, I mean, the healthy range for a woman is also the same for a man. Like you need it to be a certain level to have the protective benefits. But we just don't routinely measure it or check it. And we don't worry about a ratio either.
And did you answer what drug you use to treat thyroid?
So yeah, I mean, we primarily use like natural desiccated thyroid, right? So, we use compounded form mostly, but, commercially it's, like NP thyroid or Armour thyroid are two of the popular ones.
On our hormone stacks episode, somebody commented, not everyone absorbs hormone cream. For us, injections are needed.
Typically, if I hear that from somebody, they were not applying it to the area that we recommend. So we'll have people come in and we highly recommend, like probably 98% of our women are on testosterone cream. We have a couple that do injections, but if they've tried it in the past and they think it doesn't work for them, it's generally because they're applying it to like the inner thigh or the stomach or somewhere that you're not going to absorb it as well. And so that's why all of our patients apply it to the labia.
Or it's a bad cream. Like
That's true too.
you know,
Quality of the
that's
cream.
the other one too, because let's face it, like not all compounding pharmacies are created equal. And like we've seen this so many times. We've tried so many different compounding pharmacies for cream, and you can get significantly different levels depending on the pharmacy you're using and how well they can make a hormone cream. And that's why, you know, like for women, we only use testosterone cream from MedQuest Pharmacy. Like, and it is the best that we've ever found. And we get consistently great, amazing levels. Like we've never had a woman that we can't achieve fantastic levels using that cream and using it properly. So, you know, there's a few things that go into it, but the comment about not being able to absorb it right, that's just because
it wasn't
one of those methods. Yeah.
Same episode, different person commented, is there a preferred method for progesterone capsules? Orally is what I'm taking, but I've heard vaginally might have more benefit.
No, orally actually has more benefit, and that's what we recommend with all of our patients because it's the first pass through the liver that you get the sleep benefits with progesterone. Yeah. And you don't get that with any other application of progesterone.
Okay.
Vaginally is not going to raise systemic levels the way that you need to. It's just going to have a localized effect. So you're not going to get the protective levels even that you need to by doing it that way. And then orally, you know, you need to use a true micronized form, right? And so you want to try to avoid commercial products because they're not micronized the way they should be.
And adequate dosing.
They don't go up. The dosing isn't high enough as well.
Yeah.
How much NAD are you doing and how often? I love that stuff. Can we order a personal vial through you? I'm a local and can come in for a consult.
Well, I would encourage you to come in for a consult anyways. But yes, we do carry it, and we sell it to our patients as well. So dosing is going to look different for everybody. Some people will do it every day. Some people do it 3 times a week, 2 times a week. And we like to start on a lower dose and titrate up just to kind of get you used to it.
Yeah. I'd say it's one of those things that, yeah, for sure. Like it's kind of based on, you know, tolerance.
Yeah.
And, you know, how much you like, how often you want to inject and money,
price.
Money comes into play too. Cause obviously, I mean, if you're using it every day, it's going to be a lot more expensive than if you do a shot twice a week or something. But, you know, it's like, yeah, like Britt said, you definitely with NAD want to start low because it will give you like a rush feeling and sometimes it's a lot to handle. And so it's about assessing tolerance and starting low, but I like doing it every day. I don't always do it every day just because I forget, especially on the weekends and stuff. But
for the most part, we do.
For the most part, yeah. I mean, I do 50 milligrams a day typically is what I do. But I also
we have a lot of people that start at 25 though.
Yeah, and I find like I combine it with MOTS-C too, and I feel like that like amplifies it quite a bit.
Same video, your hormone stacks. Don't apply TRT on my stomach. How did I not know this?
Yes, no. I feel like that's the worst place too.
It seems like it would be one of the worst places for absorption.
I remember we had a female patient of ours who's still our patient, and she was getting irritated with applying it to labia, and she wasn't applying it thoroughly, which we see that a lot. Yeah. Like you have to rub it in really well, otherwise it can feel irritating. But she started applying to her belly, and she was getting a lot of hair on her belly. Yeah. I mean, and we have more fat there and it's just thicker skin too. So that's why we always say the labia is because the skin is thinner and more vascular. You're going to absorb it better.
You can apply it anywhere you want to apply it. But the fact is, it's like the reason we do the areas that we do is because of exactly what you said. Like skin is thin. There's a lot of blood flow. So like when you're doing a cream, like obviously you're aiming for an area that you're going to get like maximal absorption. So, yeah, stomach just seems like probably one of the worst areas for that.
That and the thighs are not great either. I've had people say that they grow a lot of hair right there too. And then it's a lot thicker and you have more fat there too.
Yeah. So. Like typically for most people, like if like the labia is an option or like a scrotum for a guy, like typically you would think like that area, like the upper inner arm where it's like, again, like where the skin seems a little bit thinner.
You still have to apply twice as much to that area though.
You're not
going to get the same results.
Yep.
Same video, our hormone stacks. This viewer said, I'm surprised you're using spironolactone, a mild anti-androgen, at the same time as testosterone, especially if you have no androgenic side effects. Wouldn't finasteride be better if you're solely wanting to target DHT without affecting testosterone?
Well, that's a great one.
Yeah, well, it's the exact opposite of what that viewer said, because what you're doing, you know, finasteride is going to systemically block DHT conversion, which again, you're going to be missing out on all of those benefits that you get from DHT. You know, spironolactone is going to just basically work at like the hair follicle, like the skin tissue level. So you're not systemically blocking DHT. You're just affecting it at the tissue level that you want to, which is you're trying to minimize acne and hair growth. And
we're using it typically with women that have PCOS and that have adrenal hyperplasia. So we're dealing with like acne and unwanted facial hair. Yeah. And it's extremely helpful. It just takes time.
Yeah. And I think that's to like the other part of their question is why would you use it if they're not having any of those side effects yet? And it's just for what you said, because it takes time. Like it can take up to 6 months for it to start working. So if someone has a lot of like insulin resistance and or PCOS, and you know that they are prone to getting some of those side effects, like it can be a good strategy to start utilizing it from the start. Is it like a preventative measure before those things happen, just because it can take so long to start working?
But usually it's somebody that's heard it and requesting it. Mm-hmm. Typically we don't just start people on that unless they clearly have adrenal hyperplasia.
Mm-hmm. Yep.
So, and that would be like maybe a third of the female patients.
And this is our last question, guys, from the testosterone therapy for men and women episode. A viewer said, my wife was out on progesterone and test, but they told her estrogen was fine, but all her symptoms, dryness, pain during intercourse, basically no desire. And yes, I'm attractive and in good shape, so hopefully it's not me. From what I'm reading, estrogen is what she needs for all of that.
Well, first of all, age is going to be the first thing, because if she's not in menopause, then estrogen is not the best thing. But if she is, it could be very helpful. But things such as testosterone especially is going to be extremely helpful for like vaginal dryness, atrophy, also like lubrication. Mm-hmm. So what else? What do you think?
No, well, I mean, the testosterone applied correctly is exactly what she needs, you know? And so, yeah, I mean, I think he, again, like he wants to think estrogen, but testosterone is going to give her the biggest benefit in those areas specifically that he mentioned. If it's done correctly.
Cream applied to the labia.
Yes.
Yes. Yeah. Which, you know, again, we don't highly recommend injections for women. Like we do offer it if they request it, but the vaginal applied to the labia testosterone cream is going to be the best for any of those type of symptoms when it comes to dryness, atrophy. What was the other part of it?
No desire.
No, yeah. Yeah. The cream is going to be the best.
Yeah. And again, it's like, if there's nothing, like if you want to do injections, like do injections, but just know you are going to be missing out
on some benefits,
on some benefits that you're going to get with the cream. So, I mean, it's like, we just try to encourage everyone to do that. But there are, like you said, there's a small percentage of women that just do not want to do the cream and they just want to do injections, and like that's fine. You just aren't going to get
but
some of those benefits.
If she came into our clinic and she was clearly in menopause and hasn't had a cycle for a year, we still are we're going to recommend testosterone cream applied to the labia and estradiol that's taken orally. Yeah. Like that's going to be our recommendation.
With progesterone.
Alongside progesterone. Lots of progesterone.
Well, that's all the questions I have for you guys.
Cool. Thanks, Kolton.
I'm just really happy that you didn't show up here with some hot jelly beans today. I was a little nervous, I have to say.
I'm trying to get those chips.
Dude, I don't want to do the chip. Dude, I've seen people like lose it after trying those, man.
I want to do the chips, and it's like, but then I'll go get 3 Taco Bell tacos or Cultura, and then I'll hide the chip in one of the tacos.
Oh, really?
And then whoever gets it wrong.
Dude, the jelly beans are at least manageable. Like I've seen people do those chips, and it's like I'm afraid like I wouldn't be able to like finish the episode. If I, you know what I mean? Like some of those are bad.
I struggled.
Yeah.
People hurt.
Well, I just want to thank you all again for tuning in, for all of your comments and subscribing and watching our episodes. We really appreciate it, and we wouldn't be where we are without you. So thank you again. And like always, please like, share, comment, subscribe, and we will see you next time. Thank you.